How to breathe in labor. That is what we are focusing on today. And today is day one of a 15-day series of classes on talking about this topic. Since this is day one, I want to just touch on why this is such a valuable skill to master. Breathing, I like to think of it as a foundational skill. And what I mean by this is that it is almost the bottom, the foundation, like the foundation of a house. Of if we put all of our skills for how to deal with labor, how to deal with challenges of childbirth, if we put those all sort of stacked up, breathing would always be at the bottom. And it's because it is the one skill that we can use no matter what. So some tools we don't always have access to. So let's say maybe something like moving in labor or changing positions. Sometimes we don't have access to that depending upon our monitoring status. Now, usually we do, but there are times when we don't. Like, let's think about a cesarean birth. We don't have the ability to move for comfort. But breathing, we always have the ability to use this skill, which is why I believe that it's really so foundational. You can use it in all situations, at all times. And it's something that can be used as a layer, as a powerful layer. So if you can really get this under your belt, you have it's so powerful, moving forward and learning the other skills. The other thing that I hear about a lot of times when I talk about using breath in labor, and the question that I get is, doesn't it come naturally? Like, we've been breathing this whole time, right? Yes, we have been breathing, but using your breath means breathing intentionally, focusing on having a nice long breath. And that's what I'm going to teach you in just a minute. So while yes, it does come naturally, know that when you are in pain or when you're struggling, a lot of times, if you haven't practiced this breath technique and how to focus on your breath, it sometimes can just leave your mind. Like, you don't know, it's like you totally forget how powerful it is. The other thing is holding your breath in labor and holding your breath when you experience pain is one of the most common things that people do with any kind of pain. Say you stub your toe, ow. The first thing a lot of people do is just hold their breath. And so holding your breath increases pain. And we don't want that in labor. We want things nice and loose and reduce our pain. So while it comes naturally, it's not always easy, but we are going to learn the technique so that it gets really wired into your brain so that it doesn't take extra thought. That is, as the contractions start, you're just going to go naturally into it. And that's what this practice over the next 15 days, I know, is going to get for you. Okay, cool. So today, as I said, we're going to start with the basics. We're going to practice basics. And as we go through tomorrow's class, we're going to add just a little bit of an extra twist to it and give you just a little bit more skill with this breathing. So I invite you to just get into a comfortable position for today as we practice our basics. What I usually recommend with breath is an inhale through your nose and an exhale through your mouth. Now, a lot of people especially at the end of pregnancy and this time of year, frankly, might have some nasal congestion and have difficulty getting a nice breath in through the nose. Not a problem. Not a problem. Just do whatever feels comfortable to you. But if you have the ability to breathe in through your nose and out through your mouth, that is a great strategy. The other thing, depending upon how big your bump is and where you are in pregnancy, you might not have the ability to really fill up your lungs the way you might have, pre-pregnancy. Also, totally okay. You don't overthink this. Don't feel like I'm not doing it right because I'm not able to match the pace that I'm going to show you. That's okay. The real power is feeling this in your own body and how it works with you. So don't expect to look exactly the way I do, but the point is to be intentionally breathing. So we are going to do about 10, or let's do 10 breaths together. And you can count with your breaths, so if you're not doing it at the same pace, just on your hands as you do that final exhale, just, count on your fingers so that we do 10. That's going to be enough to really practice our speed, practice our intentionality of breathing. So I like to start with one big kind of cleansing breath, a big breath in and a big breath out. And then, so we'll start with that. And then what we're going to do is just focus on filling up our lungs, slight pause, and exhaling. Filling up our lungs, slight pause, exhaling. And then there's a slight pause after the exhale. And again, don't overthink this. You're just getting a practice of thinking about your breath. And it might feel awkward. It might feel weird, but that's why we're doing it together. Okay. So if you're feeling awkward, just look at me, right? So it is just the practice of doing nothing else, not scrolling your phone, not watching me, but not watching something else and just breathing. Okay. Let's get started. We're going to do that nice cleansing breath in and out. And then let's start our 10 breaths now. In, pause, in, We just did 10 together. Now, tell me what you thought. Let me know. Did this feel natural? Did it feel short? Were you matching me? Were you able to do longer breaths? Maybe you're still breathing through it. That, I would say, for me, that was probably on the shorter side. And I'm trying to make it a little bit shorter because I know that when you're pregnant, your lungs don't fill up necessarily as long as when you're not pregnant. So just the act of doing nothing but practicing that breath is going to get you into that mindset. Because what happens is when labor starts, you'll start feeling some discomfort. You'll start feeling, okay. And when you feel like you need to deal with it, when you can't ignore it anymore, when you can't sleep through it anymore, your first go-to is just what we just did, those 10 breaths. So when those contractions start, you don't want your mind to be thinking about anything, what's ahead, what's going on, how is this going? You just want to start intentionally breathing. And partners out there, you will see, okay, she must be having a contraction, because you see, instead of just talking or doing something else, that you see that breath coming. You hear that inhale. It's like, okay, this must be a contraction. So simple, right? So simple, but so powerful. Again, this daily practice is going to help you get this locked in. So nice and easy. And I thank you so much for joining me today. And I will see you guys tomorrow. Thanks for watching. Bye, everyone.